One of the things I am seeing a lot about right now is stress.
Okay.
You know, the quote dangers of stress, and I recognize stress is dangerous. Which is why I tend to give it instead of receive it. But I don't want it. You can have it.
You can have it.
It's
Yeah,
pretty simple to me. But yeah, cortisol
Yeah.
in short bursts is a lifesaver. But in chronic administration, whenever we've got something going on that we're just stressing about all the time, our body doesn't know the difference in a real danger and an emotional danger.
Right.
You know, so when you've got anxieties, what's happening is your body is interpreting whatever situation you're in as a physical danger.
Correct.
And so you're kicking out enormous amounts of cortisol, which is our short-term, there, baby, everything is okay hormone.
Right. Yeah.
Okay.
So if you're out in the forest and, you fall and you break your leg, you will panic for a few moments, and then all the cortisol flood will come in and tell you you're going to find a way to get out of this. And you'll be convinced you'll find a way to get out of this right up to the moment you die. So
Unless it's a Hallmark movie, then,
that's right. In which case,
your old boyfriend
miraculously-
comes and rescues
Yes.
you. Yes.
But most of us are not out in the forest breaking our legs in the
Right,
wilderness. Most
right.
of us are having work stress, family stress,
Indeed.
newspaper stress,
Yes.
television stress,
Yeah.
political stress, all kinds of stressors that our bodies are pumping out that cortisol consistently.
Sure.
And here's the problem with that. When you've got that unending flow of adrenal stimulation and cortisol production, your immune system is being suppressed. Okay? Short burst heightens the immune response, long term suppresses the immune response.
Right.
And so your risk of cancer starts to rise. You can literally stress yourself into a cancer. Your immune system shifts dramatically. You
Yeah.
become less and less capable of fighting any infection out there. So bacteria, viruses, funguses,
Yeah.
all start to have their way with you
You're right.
because now your immune system has been suppressed from the chronic anxiety or stress.
Yeah.
Neurons start to die. You actually start killing your brain from chronic stress and anxiety. You are headed towards dementia on the fast track
Right.
if you can't de-stress and relax. So there's a whole lot of bad stuff. You're developing cardiovascular disease, you're developing peripheral neuropathies.
Sleep
and
impairment.
If you're like me, you're a stress eater.
Yeah.
So
Yeah.
you
Weight
start-
gain. Sure. Sure.
You start making yourself feel better with
Right.
the calories and the comfort foods,
Yeah.
which just makes you fatter,
Yeah.
which then increases inflammation to go right along with the poor immune response. It's a cascade.
Yes.
And so then the question is, fine, how do we get rid of stress and anxiety?
Right. Chronic stress. Yeah. So like in the short bursts, as you're saying, it is basically to prepare you for fight or flight.
Yes.
But then the cortisol levels should go back down to normal and stay low, and then be ready to give you another spike when you need it. But if it is chronically high or high level because your boss said something, or you're late in the morning, or you have to pick up the kids, lunches aren't ready, or you have to make it to the doctor's appointment. These things, traffic is terrible. And these things do stress us out.
They do.
But that raises the cortisol level as well, and that's when we run into chronic problems.
Right. The common things that I see recommended for stress and anxiety worry me. Do I really want to go on benzodiazepines
Yeah.
and anti-anxiety agents and antidepressants and so on to cope with stress and anxiety? No. Such stressors as I get are not a Prozac or a Valium deficiency.
Right.
So I'm not going to treat them with those things. I see people talking about, well, then you need to meditate.
Yeah.
Sit down, gaze at your own navel, and get yourself in contact with the cosmic Om, which bores the hell out of me. I fall asleep.
Well, it's a learned art, but for those who do, they find a lot of benefit and calm in it.
So I am told. Yes.
That's right.
I have talked to people who meditate on
Yes.
a regular basis.
we are surrounded by stimulation 24/7.
Yep.
And sometimes how we handle it is not appropriate. Like you said, you give stress, not take it, but some people can't brush it off that easily. They imbibe it and it affects their life. And so for those people, it is important that they learn how to get away from the constant stimulation and then find a space. And then if this works for them, hey, I'm all for it. If it works for them, that's fine.
Yeah.
I can't do it, but
For me, it came down to a saying that I heard many years ago when I did a rotation in a drug rehab unit
okay.
as an intern or first year resident or whatever. And the phrase was, "Not my circus, not my monkeys."
Yes.
And
Remember that. Yes.
Yes, I've said that many times.
been around for a long time.
Yeah.
And I guess that's pretty much my attitude.
Yeah.
You know, your stresses are your stresses.
Yep.
Mine are mine. And guess what? I'm too busy to mess with mine.
Yeah. Too busy to mess with mine.
I am too busy trying to be productive.
Yeah,
I have things I want to accomplish in life.
Right.
And what I have found through my 77 years, now I'm on my 78th trip around the sun. I enjoy travel, 78 trips around the sun. Is I have to accomplish a little bit every day.
Yes.
I don't have to do a lot because my goals are pretty big. But if you do a little bit every day, and each day you finish with just a little bit more towards your goal,
Right.
at the end of the month, you've accomplished a fair bit. And at the end of the year, you'll be shocked at how much you have done.
Yeah, you're absolutely right.
So I am a goal-oriented person.
Right. Right.
I want to rewrite so many blogs a day. I want to read so many medical articles a day. I want to then take a little time to contemplate what I've read.
Yes.
And I guess that's my substitute for introspection and oneness with the universe.
Sure.
Is looking at the paper, stopping to think about it for half an hour, saying, do I agree with what this author wrote? Do I think his conclusions make any sense to me?
Yeah.
And sometimes it's, no, he's full of poo-poo. Just because he got it published in his medical journal doesn't mean it makes any sense.
Sure. I mean, we've said this before, that you can read a medical journal and three different people will have three completely different opinions about that article.
That's right. So, my question is, what do I say to my patients, to our patients, about stress management when I'm not very good at it myself? I pretty much ignore it and do what I want to do. Now, the reality is I lead a joyous life. I am probably one of the happiest human beings I know. So I must be coping with the stress in some sort of reasonably productive way.
Yes.
That, as we all know by now, that is what led me into medicine. I started life as a young combat soldier, and the extreme violence of those years, made me decide to become a physician and spend the rest of my life helping instead of killing people.
Right.
So I guess I've taken that avoidance technique for the last 70-some years. I just try to stay out of stressful situations and do what I want to do and do what gives me joy.
Yeah, and that's a good message for people,
Yes.
Focus on yourself and focus on what brings you joy.